in our research, we had two main aims, which was to look at how much exercise patients actually are doing in a typical oncology unit, like Bedford Hospital, and secondly, to find out whether patients had any concerns or barriers that were limiting their exercise levels, if any. We used a validated screening tool for exercise known as the General Practice Physical Activity Questionnaire, which is a very useful tool for kind of objectively categorizing how much exercise patients are actually doing. And what we found was that only 11% of the patients in our cohort were achieving active levels. That means that 89% were insufficiently active and should be advised to do more exercise. Another aspect that arose from our findings was that patients are actually more aware that exercise is good for them, so the message has gotten out there. I think what we need to do is to now adapt information material so that they don't focus just on relaying the message that exercise is good for you, but also to kind of understand why patients are still not doing enough exercise even though they know this. And what we found is that a lot of patients are concerned about doing more exercise for health-related reasons. So because cancer patients, they deal with a lot of stresses related to their diagnosis and their treatment. So they often feel that they're too tired to do exercise, they're in too much pain to do exercise. A lot of patients also feel that they can't schedule exercise into their busy timetables. And there is still a subset of patients who are aware that exercise is good for them, but are still not sure, still don't realize how much exercise that really requires. So 25% of the patients in our cohort thought they were already exercising enough. And it turns out that they actually, only 25% of these specific patients were actually active on the GPPAQ. So I think what we need to do is adapt information material so that we now reassure patients that exercise can be and is safe, especially if they can be referred to formal exercise programs where they can be supervised by trained professionals. And these trained professionals can kind of tailor exercise programs and address any individual concerns that patients might have. We think it would also be useful to have expand roles for possibly dedicated lifestyle and physical activity advisors who will be able to sit down with patients, go through all their concerns. Exercise was the main factor. We did collect some data on smoking and obesity. So 68% of our patient cohort were overweight or obese, which is obviously also a risk factor for cardiovascular disease and increases the rate of side effects as well. So that's another aspect that would be helped with doing more exercise. And we did look briefly at smoking levels. So only 7% of the cohort are currently smoking. 52% were ex-smokers, which does suggest that there is a trend towards succeeding in helping patients kind of give up smoking.